Hello, good afternoon. My name is Dr. Harpal Jadeja. I am working at Medcare Orthopedic and Spine Hospital. I've been trained in the UK for the last 20 years, and since 2011 I've been working as a consultant orthopedic surgeon. Since last 3 years I've been working here in the UAE, and my specialty interest is foot and ankle surgery. I've done 3 fellowships in foot and ankle, and I'm well versed in treating with all the different simple as well as the complex foot and ankle problems. My interest is the deformity surgeries, be it a flat foot or a high arched foot, and the common deformities like hallux valgus or the bunions as we call. As it is very common, I would just like to speak something on that. It is one of the commonest deformities with which people come to my clinic and tell me about the different causes and the problems and the queries that they have, and I try to discuss some of them with you. One of the things which they say is, why does it occur? Well, there are so many causes, and the commonest causes is to wear the inappropriate footwear. It is the most common cause amongst many others. It also runs in the family, and almost about 15 to 20% of people do have a positive family history. The other other reasons can be inflammatory conditions like rheumatoid arthritis, and the structural deformities of the bones, as well as the insertions of the muscles and the tendons. A long arch is also one of the causes which can cause a deformity and cause. The other common complaints or the things which they come is with the pain. The problems are the pain, the deformity, and inability to wear the shoes. The pain is the most common of all the complications, all the symptoms with which they come. The other thing is about wearing the different shoes. Yes, we all have our personal and the professional lives, and we do wear the different footwear. And this is where they come in certain professions where they need a simple shoes or a specific kind of shoes because of the deformity and because of the splaying of the forefoot. They cannot wear it, and hence they come. Other things which they say about whether it will get worse or not. It is in a simple one, they usually do not get more deformed over a time, but as it is a deformity, it progresses and gets worsens over the time. After a certain degree of deformity, the progression is far more faster and can cause the problems with the lesser toes. And then they say whether it can be treated with operation or without operation. The answer is both, depending upon the symptoms. Many patients come and I tell them that if the deformity is causing the problems with the pain on every step that they walk around, and the difficulty in wearing the shoes, doing and the gym activities, it's difficult to wear the shoes, and then it is the time to get the operation done. Why? Because the operation is a simple operation. It usually takes about 45 minutes to an hour to do the operation. It can be done as a day case procedure, so you go home after the surgery in the evening, and if it's done on one side, especially on the left side, you can drive as well after that. The other thing is that it does not need any plaster cast, and can be used in a special kind of shoes which you can walk on your heels and protect the forefoot after the surgery, and most people are very happy with it. The success rate of this operation is about 85 to 90% of them are very happy. So I think it's an important thing. If it is painful, it's causing you problems over a time, then it's a simple procedure with an excellent results. Right, so this is what I would say. I'll be taking some questions. And I will introduce my colleague who is there, who will be able to help, is Mr. Rayed.
Hi, Dr. Harpal. How are you?
I'm fine, thank you.
Thank you so much for the information. It sounds great. Doctor, how painful is the surgery or the recovery after surgery?
Yeah. Usually, I think it is just like it's a simple procedure, as I've said. It takes about 45 minutes to 1 hour, so it's not that painful. It's not a very prolonged surgery where you need to do lots of stretching or other things which can cause pain over a time. But most of the times we give the blocks around it so that the patient usually does not have any pain. It's likely in about 10 to 15% they may have some pain, but the pain usually is given, painkillers are given after the operation, and usually after 2 or 3 days they're usually fine.
That's nice. And doctor, what are the signs that we should do the surgery? Should the pain scale 10 out of 10 to do the surgery, or it's optional for people? Some people may do it for only a cosmetic reason.
Yeah, I think pain is the biggest indicator for having a surgery to correct the deformity. And the pain usually, as we know, in the modern times and everywhere, we just want to go for our personal reasons, to go for the holidays, to go for shopping, to walk a lot. We do walk a lot, and patient with the hallux valgus deformity or the big bunions, it finds it difficult. Every step is painful because it rubs against the shoe, and it becomes difficult to walk more than 5-10 minutes. If these are the symptoms, then I think it's best to get it done.
Doctor, you mentioned it can be inherited or in the blood, not a must to develop over the years because of the footwear?
Yeah, I think it is both. As I said, the large majority of the reasons is the inappropriate shoe wear, and that causes the compression and causes deformity further. It enhances the deformity, and it progresses further and worsens it because of the tighter shoe wear. The modern shoe wears are tight, as you can see, especially in the ladies, and that is one of the reasons it's more common, 4 or 5 times more common in women than in men.
What kind of shoes may cause it, doctor? Is it the heel or the shape of the front part of the shoes, or both?
Yeah, it is the toe box that is more important in there. Yeah, I think if it is a very narrow toe box which cannot accommodate the 5 toes, including the great toe, and the pointy ones, the ones which are pointy, which are very nice, it looks very elegant, and that you can see in loads of stores selling that. But I think the ladies, they do love that, but there's also things that can go, that you can have it after that. It is after a long time, although that is not a big problem in that way. However, as you said, that you can definitely wear the high heels, and it's not that big a problem, because the high heel usually causes the stresses onto the great toe. It causes the stresses into the joint and can cause arthritic changes in that.
Okay.
But the combination of high heel and the pointy shoes are the ones that usually causes that. But actually, it depends upon person to person.
I've never seen high heel and it's not pointed.
Yeah, so that is what the combination is the one.
That's the elegant, fancy combination.
Yeah, I think that's one thing we can say. Yeah, that is an elegant combination, but that is what it is. But as I say, there are good solutions for that. These are all the fashions, and these latest fashions with the good shoes, and well, the Gucci's, the Manolo Blahniks, and all those that have come with these kind of things. But we have solutions for that as well.
Sure. Doc, you mentioned in men it's much less than women. What kind of footwear? Men never wear heels. Men, I don't know how pointed that men footwear can be.
Yes.
Is it are they the same reasons, or there are different reasons for men to have this deformity?
There are. I think the tighter shoes, the tighter toe boxed footwear is one thing that usually causes that. The men, I think they do have the pointy ones as well, but most of the men, they will have a wider toe box one, which usually accommodates all the 5 toes without that big a problem to move. It is only when the shoe wear is, when the footwear is very narrow, that is where it causes the problems. There has been a study done in America, about 5,000 women. They had done a survey, and they found that the shoe size is 1 size smaller than the actual size of the foot, and that is one of the reasons it's more common.
So when we buy a new shoes, it's not only about the length. We should be so careful about the width of the toes box?
Yeah, it should be there. Yeah, within limits. I think I know we have different occasions. Yeah, if you're doing on a day-to-day basis, then it is be worthwhile. But I think it's absolutely fine on social occasions where you need to look good, you need to look elegant, and that is what I think it should be there.
So the daily shoes is the most important.
The daily shoes should be comfortable and it should accommodate your toes without any big problems, without getting it cramped inside. And that is what I would suggest here.
So, doctor, does wearing flip-flops or slippers cause this deformity or not at all?
Usually not, yeah, because that is what it's a open toe box footwear. Yeah, so it is all the toes, they have got the liberty to move anywhere and however they want to in an open toe box, and that is one of the advantages that usually you do not have. So flip-flops are not the cause of that.
How about walking barefoot at home?
I think that
Being
is,
barefoot.
it certainly has nothing to do with the deformities or with the bunions. But that is a good exercise to do because some of the small and intrinsic muscles of the foot, they get stimulated by that. And I've seen reasons when you only wear the footwear which does not allow the movements, the barefoot and the responses, the small intrinsic muscles of this one, they get wasted and you come up with a claw deformity. So that is why I think it is important to do as much as you can do.
So on another hand, walking barefoot at home is something...
I think it's a separate topic than this one, but I think it's healthier. I think, in my opinion, it is a healthier opinion.
Good to know that, Doc. Doctor, quick question, does insurance cover this surgery?
Yes, most of the time the insurance covers these operations, and they're happy because they do understand the problems which people face on every step. It is pain that is not a good idea to have. And also, there are certain professions where you need to have a specific kind of shoes, particularly in the airline industry, where you need to have a specific shoes, and there's a possibility of that. That's usually, the most of the time we don't have any problems. But if it's only for cosmetic purpose, they usually will not approve that.
So because many ladies, I think they would love to do the surgery just to enjoy wearing slippers or open shoes or flip-flops more often, looks better. That's the cosmetic reason, I think?
Yeah, that's cosmetic reasons because it doesn't look good when it is barefoot, when you're going on the beach or on the holidays, or you're walking around. So then having the bunion is probably one of the things that can lead to a lack of confidence in many people. And that can also be one of the reasons to do the operations.
Okay, doctor, after the surgery,
yes.
Any specific kind of shoes I need to wear, and will my shoes size change or remain the same?
Right, so the surgery, what it does, basically, when the forefoot is splayed, the surgery does it to reduce that splay and makes the medial or the inner and the outer borders parallel as best as they can do. So that will reduce the forefoot splay. However, the size would remain the same. So the number of your shoe size will not reduce or not increase or not change. But this is and as I said, you mentioned about the shoes, which shoes will be needed. This is the kind of shoes which is, it is very light shoes, and most people are very happy with this thing. It has evolved over the time. Previously it was very heavy, but now it is very light. This is where you can you can walk on the heels like this, but the surgery, when it is done here, this part of the forefoot, that is much more protected. And that usually you have it for 6 weeks, and you're very used to that.
So this is, let's call it the recovery shoes.
The recovery shoes, or the dark, or the post-operative walking shoes, or a heel walker also, this is called that.
Doesn't look bad actually. It helps a lot.
Right, but probably I think our the lady colleague will have a different opinion about it. But this only for 6 weeks, and then you can wear a stylish, elegant shoes. And I think one of the advantage of the operation is that because the splay is reduced to normal or normal looking and straight grade first ray, you can wear the shoes for your choice. Including the one you can just get the pointy or the elegant ones. You probably can show us.
So doctor, you mentioned the success rate is around 90%?
Yes, about 90%. People are very happy with it.
And what is the recurrence rate?
The recurrence rate, it's largely at about between 5 and 8 out of 100, which is much, much less. And it is I think usually the recurrence rate is not going to be much deformity. So it can be a minor deformity, which usually people tolerate, and that is not a problem.
So ladies will feel more happy after the surgery.
Certainly. So I think in my experience,
no
they'll be
future
very, very
deformity
happy.
to worry about.
No, nothing about that. Yeah, I think, and that is the main thing about the surgery. So I think it is an elegant surgery, small surgery. Usually it's a day surgery, and you go home the same day. It can be done under regional block as well, so you don't need to be put to fully sleep like general anesthetic or a spinal. Yes, those are the choices as well. There are some people who are really afraid of the local needles, and that's why they don't prefer the local anesthetic or regional anesthetic.
Put me to sleep, then do whatever you want.
Yeah, that is one thing. That is one thing which I give all the choices to them and then discuss with them frankly and see whatever their opinion is, and depends upon that. But it can be done under regional or a local anesthetic.
And you mentioned that it can be done both feet at a time or one of them. It's up to the patient to wear two of this or just one.
Yeah, it is. Yeah, I think it is entirely. I discuss these options to the patients, those who have it on both the sides, and it's about 80% of the time it is on both the sides. So I just discuss them, and say it's very important and a common discussion that I have in the clinic about whether to get it done on one side or both sides. Usually, if one which is more painful is one thing that you will prefer to do, but it is an option if somebody wants only in one anesthetic, it can be done on both the sides. Yes, it can be done both sides. You'll be walking on these two different kinds of shoes, and that will be for about 6 weeks. It does reduce mobility as compared to if you're operated on one side. But they cope very well, and it entirely depends upon the support and the will of the patient.
So it's up to you. Finish it all at once or one by one.
Yeah.
Doctor, can we talk a bit about athletes? Do they get these bunions in their feet more than normal people, or it's not related?
It is not, but it is certainly that they do have the problems as well, and that, as I said, the many other factors are there which I discussed earlier. It is, but they do have the problems about the bunions.
Maybe because they need to wear tight shoes for football or jogging or running.
I think usually they wear not the tight, but they wear the soft-fitting shoes, and then whatever is the snugly fitting shoes which are comfortable. That's what they usually have. Yeah, but they don't have, and I don't have any further information on that they have a higher chance of having bunions than the normal population.
Okay, good to know that. Doctor, what do I expect after surgery? Any swelling around the big toe? How many stitches? Where will be the stitches? Or is it just single keyhole surgery?
Yes, interesting surgery. I think interesting question in that. I think some of the things we can be done in the traditional way that we do to correct this one. If it is a bigger deformity, you'll have a bigger and open. I do it in a traditional way. We can do the surgery on this one to correct and fix it up along with this one. And there are many other surgeons who do it with a keyhole surgery or a soft and a small incisions. But overall, I think usually I have never complained. I've done traditionally with open, with the severe deformities as well. They heal very, very good, and after 8 to 9 months of that, even they can't know where the scar is. It is just like that. So scars is not that big a thing, and nobody has complained about that.
And the scars on the side, I think?
Scars is on the sides. It can be done on this one, but depending upon if you're doing any other surgery along with the great toe. If they say second or third other toes, then you can have the smaller incision that, and you can just do that.
So the bunions may develop on the second and third toe as well?
No, that's right. No, I think the bunion is about that. Bunion basically in the language is bunyo means it's a turnip. I don't know what it is called in
vegetable.
Yes, it's vegetable. So it looks like that. That is why. So it is the great toe. Why it occurs here? Because the first ray is a bigger ray, it takes lots of weight and everything, and it has got, as I said before, so that is where it happens here. That is the bunion. But the fifth toe in here, that also contributes something, and we call it bunion net. It's just like that. The difference, net is a smaller deformity as compared to this one, just like the cigar and cigarette. The cigarette is small, cigar is big, so it's just like the bunion is big, and bunion net is a small or the little toe.
It will develop on this joint.
It will develop on this joint, and that again it causes the splaying more. So because it deforms like this, it forms a little bone there and one in here. So that causes the more splay of the forefoot like that, and that
So the
causes
foot is
the problem.
more on triangle shape instead of.
Yeah, it looks
being
like that, so
parallel.
it's placed like that. Yeah, your heel is always narrow, and this is what it goes like that.
Doctor, what is this interesting thing over here? Can you tell us about
Right.
it?
Yeah, that is,
What
yeah,
does it
that
do?
for that you need to see this one, this deformity. Yeah, just like that, I can say it this way. Yeah, this is the one that is one of the devices which is usually sold by some of the pharmacies and all. This is basically for the conservative management of that. Yeah, as a bunion, yes, you can see if it is. Yeah, it is usually, the pain is usually caused by the rubbing of the prominent bone against the shoes. So this prevents it from getting that. But looking at this one, as you can see, it will be difficult to wear the shoes, particularly the women, which they usually wear a little size, little smaller or snug fitting ones. It will be difficult to wear certain things. But there are many other devices. This one is probably a little bit more coarse and a crude one. But there may be other small ones which are snug fitting. It can be used as well. The spacers are available which you can put it between the great toe and the second or the index toe. And that also there. But the moment you remove that, the deformity comes back and the deformity will not go. The only thing that would correct the deformity is the surgery.
So this is. It will not help.
I can't say that it will not help, but it certainly is one of the options and one of the choices. Yeah.
Will it help in the very early stages?
It doesn't. In the very early stages, they usually don't have any problems. So that's why they don't come.
Or can we say it's. Or let me ask you the question another way. Any home remedies, any other solutions than the surgery to.
Yes, of course. Yeah, there are certain shoes that you can have with the broader toe box. Yeah, this is, you can see it is a broader toe box, not this one, but the others. If you have a broader toe box which accommodates the deformity, then it is fine. Yeah, that doesn't need any surgery.
So the
initially.
deformity will stop and not to develop more.
No, that is not the thing. Yeah, so it accommodates, but I think with the the time limit is reduced by that because it is there. But it is usually a progressive disease. It progresses, particularly with the different shoes that
Even
we need
if
to
I
wear.
relax it with the different shoes or whatever, it will keep on developing.
Yeah, it is likely to be there.
slowly.
It is likely to be sure. But and after, it usually progresses slowly if it is a milder deformity. But with the different kinds of shoes that you wear on normal day-to-day basis, including sports and other things, if it reaches a certain deformity or certain angle that we calculate on the X-rays and everything, after that, the deformity progresses and worsens faster. And then it pushes, because this being a very big one as compared to the other small lesser toes, it pushes the other toes and then causes the deformity of the lesser toes, like the clawing of the toes and the mallet toes, hammer toes,
Sometimes it reaches
etc.
the nail as well. The nail will have some deformities.
Yeah, nail, yeah,
Like
because
very
that part of the
advanced
tip, usually it will be there when it rubs against this one, it can cause callosities as well. So those are the things which can cause the problems there, because it pushes on that. And the severe deformities, because it goes like this, the great toe or the second toe, just it overlaps onto that and then causes problems like that. Unfortunately, I don't have the models to show that way, but it certainly is a possibility.
So the toes are stubborn. The more we squeeze them in tight shoes, the faster they develop this condition.
I wouldn't say faster, but yeah, they do develop in that way, yes, because the deforming force are constantly pushing it, and the number of hours of the shoes that we wear, tight shoes, it keeps on pushing it at that time.
Absolutely. We wear our shoes not less than 10 hours a day.
Yeah, that is what I'm
Going
saying.
to
And then
work
if it
and
is
so
a
on,
tight
so-
one, it will be like that.
So
Yes.
your daily shoes need to be really comfy, not only stylish. Maybe we
Yes,
can.
of course, yeah,
You
there
need to
are-
balance the style with how comfortable it is. You are wearing it almost half of your day. Thank you so much, doctor.
Pleasure.
That was great.
And thank you for giving me the opportunity, and thank you very much.
You are most welcome, doctor. Thanks a lot.
Yes.